C9000. In neurological rehabilitation, it's important for the patient to start exercising as early as possible. Therefore, an individual optimal partial weight-bearing system over slow-speed treadmill, speed range 0.2 to 10 km per hour, is crucial for the patient. The single-point suspension allows dynamic up and down movement when walking, and at the same time allows freedom in movement and body rotation. The partial weight bearing, which depends on the progress of therapy, can be adjusted between 5 kilograms and 35 kilograms, 11 and 77 pounds. The C9000 Safe Walker starts at the slow speed of 0.2 kilometers per hour. The C9000 Safe Walker allows the user to walk continuously within a restrained space. Another advantage is the ability to use a suspension vest for partial weight bearing for individuals with impaired motor function. In addition, it can provide both incline and decline walking surface, thus providing a different scenario of locomotion. Introduction to product and features. 1. Speed range 0.2 to 10 km per hour. 2. Emergency stop switch system. 3. Contact heart rate monitoring. 4. Console control panel. 5. Pneumatic partial weight bearing system. Control panel. Unweighing range 5 to 35 kilograms. Suspension system. Suspension vest. Safety limit rope. Limiting rope length. Fall prevention. 6. Slope setting. Incline, decline. Incline-decline range plus 12% to minus 3%. 1. The suspension vest specification. Comfortable thick armpit pads. Assisted back handles design. Extra fixation leg straps. 2. Available suspension vest sizes. Small, medium, large, extra large. Waist circumference 25 inches to 58 inches. Remark: C9000 suspension vest size chart. Panel operating instructions. 1. Starting instruction. Default parameters 0.2 kilometers per hour, 30 minutes. 2. Built-in mode. Mode. Preset modes. Hill. Preset modes. Fat burn. Preset modes. Cardio. Suspension system operating instructions. 1. Instruction for wearing suspension vest. 2. Limit rope setting. 3. Suspension system setting. Cable adjustment. Reserved length 30 centimeters. Remark: suspension height and maximum user height. Console control panel operation instructions. 1. Starting instruction. 2. Adjust pressure switch and lockout. 3. To turn off, release cylinder pressure until residual pressure is 0. Training operating instructions. 1. Wearing the suspension vest. The suspension vest provides support and reduces the weight on the patient's feet while walking on the treadmill. The amount of support can be gradually increased or decreased according to the needs of patients. ensure that all the loops are proper and secured, and that the patient is comfortable in the vest. This suspension system is very easy and simple to manage, enabling the therapist to concentrate on guiding the patient rather than on maintaining the system. This reduces the chances of injury to and improves security for the patient. 3. Forward walking. This treadmill training may be a safe way for patients to begin walking when they're not able to walk safely by themselves. Partial weight bearing allows some people to start walking earlier after a stroke, especially if they currently require 2 people to help them walk over ground. It also allows some people to practice walking when they are not ready to do so over ground. Advantages of forward walking includes changes in body composition rates, improvement in the cardiovascular system, and better muscle strength and endurance have been reported as effects of forward gait exercise. 4. Side walking. Side walking works both inner and outer thighs, while also toning the calves and doubling as cardio exercise. Asymmetric gait patterns in post-stroke patients could be improved by receiving additional side walking training. 5. Backward walking. Backward walking is undeniably a different activity from forward walking and side walking. It helps seniors or patients use muscles and movements that they probably rarely use, making it an ideal way to change up their exercise routine for greater fitness gains. When walking backwards, it puts less strain and requires less range of motion from the knee joints, which is useful for people with knee problems or injuries. Backward walking may help relieve lower back pain, improve hamstring flexibility, burn more fat and calories in less time than traditional walking, improve balance, and even sharpen your thinking skills and vision. 6. Incline. Walking on the C9000 Safe Walker at an incline, the hip flexors will work harder to lift knees higher to walk on an incline. There's an increased resistance on buttocks to bend and extend the legs to lift the body higher. When walking on a flat terrain, the body is perpendicular to the surface. When walking on an incline, the abdomen must contract to keep the body upright to avoid arching the back, so that the body is not perpendicular to the inclined surface. 7. Decline. Decline walking uses eccentric muscle contraction. It also can place strain on the knees and be difficult for those with knee problems. 1. Due to an ergonomic working position and the ease of manipulating the patient's legs, the C9000 Safe Walker has developed a very simple and ergonomic solution which cares for the therapist first. 1. The C9000 Safe Walker can also be combined with balance gear system to provide patients the biofeedback and instructions on functional body position during training with a secure hold on the patient. 2. The patient is prepared for testing by being placed in a suspension vest that is suspended loosely from a suspension system. This vest is designed to prevent the patient from injuring himself or herself should the patient fall during testing. The information from the wearable balance gear makes it possible to record changes in the patient's center of mass over time. 3. Combination of C9000 Safe Walker with balance gear supports the independent training of patients with video games and audiovisual feedback related to the quality of the performed motions by using inertial motion sensors. 1. Walking with resistance band works the hip flexors, extensors, and abductors, providing a great all-around strengthening workout for the user's hips with a secure hold. Either resistance tubing or resistance band can be used for this exercise. 2. It's an excellent move that engages the major muscles of the legs while also targeting the smaller stabilizing muscles that are responsible for helping the user stay injury-free during workouts with a secure hold. Simply loop a resistance band around your ankles with your feet wide enough apart to keep the band in place. Extend one leg out to the side against the resistance of the band and continue to shuffle to that side, focusing on the muscles in the lead leg. The side walking exercise with resistance loop is actually the perfect way to improve hip stability, strengthen the hip abductors, particularly the gluteus medius, and increase stability of the knee joint. 3. Agility ladder is an ideal type of training equipment that forces the feet to adopt patterns of footwork by repeating the exercises over and over between two rungs to learn different phases of sideways movement. With the use of agility ladders, patients can improve their ability to maintain balance, strength, and coordination.